Yes, welcome back, everyone.
And hello, Kim.
Please come in and sit down, and we're so happy that you're still with us. And can I ask the people who are way in the back,
Do move
can you
ahead.
please come forward, because this will be about half of the group, or because you are the brave ones that stay till the end, yes? Can you please come forward? It'll be more nice, it'll be more like a ritual in the ending. So yes, that is nice. And then on the left side as well, because when you're in the back, it's like you're a distant, and we're friends. Yeah?
And if they don't
After
do
3
that,
days,
I
we
will just have to pester them and ask them how they are feeling on their very last day.
That's Jean, but I can't hear you, Jean. Just a second, we can't hear you.
You can't hear me?
We can't hear you.
Does this work better?
Jean is now taking my place. We've been doing this all along, and now you are in the back of the room. So what did you ask her?
Because I was just going to warn people that if they don't move up, I'm going to ask them questions. So just Jane, how are you feeling on this last day?
Oh, it's just been an amazing event, really amazing conference, very informative, and I just really am honored to be here.
Thanks so much. I think we can let her stay here. But you?
Can
Where are you
maybe
coming
the
from?
microphone's turned up a little?
Where are you
Because
coming from?
here it's very soft, both of them.
Coming from the UK.
Nice.
Yep.
And what was your feeling so far? How are you feeling on your last day of the conference?
I mean, it's been a very packed time. I've been quite unwell the entire time.
That's very
but
sorry to hear.
I'm now starting to feel better, and we're at the end. Very sad.
I hope you're going to enjoy the end there as well.
But what did she say, Jean?
She was unfortunately feeling a bit unwell during the conference, so she's finally feeling a bit
Oh
better.
no, she's been in bed for the 3 days. Oh no. Aw.
And who do we have here?
That's not good. Yeah?
James Pearson from Scotland.
And how are you feeling on this last day?
I'm a little bit sad. I think I've been to a few Alzheimer's Europe conferences. I have to say this is up there with the best of them. Exceptional. Well done, everyone. Thank you.
Yeah.
Thank you very much. Kim, should we just stay on and stay for another day?
We will just all stay, okay? Cancel all our plans and we'll be together. Like
And as I'm walking up here, let's see.
Yeah.
Who do we have here?
Jean-Bernard from France.
Yeah. And how are you feeling?
Good.
I think that sounds better. Anybody else? Oh, Kevin. It's
Kevin,
almost our
yes.
last day. How are you feeling?
The greatest honor of my life.
Fantastic.
Best conference ever.
Wonderful.
Great. That
Great.
sounds
Okay.
just what we like to hear. And another person with dementia, Helen. How are you feeling on this final day?
I am feeling sad, of course, that I have to go home, but I have to say that I am absolutely thrilled to see over 1,000 people here at this conference.
Yes.
And I want to thank you and all of your team for the
Fantastic.
absolutely sensational work you do for people like myself.
Thank you so much.
Yeah, great. Wonderful,
And
huh?
I think with that, we can move on to potentially our first session.
Sorry?
We can move on to our
Yeah, we
first
can
session.
move on to our first. You can't hear me. So, but I wanted to ask you first because, of course, there's another side to it. Who of you is a bit tired? Raise your hand. we know, we all are. So we're going to make this fun and light, and we'll just talk a little about what happened before, and then everybody will. Who will go home tonight? Hands? Tomorrow? Next week? Yeah, Kevin is permanently here. So yeah, let's go on to the first theme. Well, it's the final theme, really, because it's about strategy, it's about policy, you know, the hard parts of it.
And a lot of what we've heard before was interesting research, care initiatives, projects, but really, how do we transform all of this fantastic research, these fantastic projects, these initiatives, into something that changes legislation? And how would you get policymakers to listen to the fantastic work that's being done here by all the people that were attending this conference?
But do they not listen yet? Enough?
They could definitely listen better. Although, I have to say, at our plenary session, on the first opening ceremony, we had 2 commissioners, we had representation from the Finnish Ministry of Health.
True.
So that's a pretty good sign that people are willing to engage and listen to us.
Yeah, at least they were speaking, and now they have to listen. And then because you are, of course, a perfect diplomat, and you understand all of the parties involved, but can you tell me something that even you sometimes think, oh, please, go a little faster or do a little better? In what area is that?
I see a lot of policy discussions where we're talking about mental health, we're talking about aging, and people always say, well, dementia is covered in mental health, dementia is covered in disability, dementia is covered in aging policies. But when you really look in the documents, the word dementia doesn't sometimes even appear, although it should be covered by these broader policies. So there's definitely a lot of effort that needs to be done to make sure that dementia is really not just covered by aging, but really mentioned and included with very specific targets, budgets, and indicators.
Yes, specific and from tomorrow on.
Preferably.
No patience with that
At least
anymore.
from tomorrow.
Tomorrow on. Good. Yeah, I think that's fair to ask for that, right?
Well, they had to listen to 1,000 people for the past days, if that's not enough.
True. So what we want to ask you is on Menti again. You're probably logged into it, and if you're not, you can use the QR code. We want to know if you have an opinion of this, because we've been discussing this, that some things changed during the pandemic, and maybe it got a bit more or a bit less attention, or maybe the same, or just balanced out. If you want to vote for us, that would be nice, because we are curious to find out what you think from your experience, what you found. Let's see. Yeah, we have to give them time, Jean. We have to give them time, of course. You see them voting rapidly now.
We already have over 100 people participating, so that's pretty good.
Yes, what I think, what we're starting to see here, it has not changed, is what majority so far says. But what is your opinion on that, Jean?
I would say I would potentially agree with some of the responses, because only 1 in 5 believe that it's more of a priority than it was before.
Yeah.
And I would definitely agree with those people, because I don't think it is more of a priority than it was before COVID. So sometimes it has dropped a bit off the radar in a number of countries. So we need to redouble our efforts to make sure that it gets back on the agenda.
It's strange, though, because you could have seen people in danger and people isolated and people in all kinds of horrible situations during the pandemic.
Of
so
course,
it should be
because
higher on
the
the
number
agenda.
one victims in a lot of care homes were people with dementia. People with dementia were more likely to develop COVID than other people. And even in those cases, sometimes we were forgotten. But hopefully, after COVID, we are going to get back and have us recognized as a priority again.
So 30% says less of a priority, and maybe the middle part also, because what you said before it had slightly more attention, and then that decreased a little, right?
While I was speaking, that's always interesting to see how you're influencing people while you're talking.
during time. So yes, okay. That's what you think, and we're about to find out what many experts feel about that. So let's invite 6 experts from different fields on stage and discuss a little more to close the conference with. So let's invite Andy Heffernan, please, from the Alzheimer Society Ireland. There he is, yeah.
And we have Taru Koivisto from the Ministry of
Wait a second.
Social Affairs and Health from Finland.
One more time, the name?
Taru Koivisto.
Yes. And now, the chair of the Dementia Carers Working Group, the carers, they are here, Sonata Mačiulskytė. Mačiulskytė. Welcome.
And we have the council president of our host organization, Muistiliitto, and it's Remes.
Remes, yes. And of course, our chair of the working group of people with dementia, Chris Roberts. We've seen him. We're back. Yay! It's the whole fence.
There's no favoritism at all going on here in this audience, as you can tell. And the last but not least speaker is Elina Suzuki, who is a health policy analyst from the OECD, which is the Organization for Economic Cooperation and Development.
She needs woohoo too. Woohoo! Woohoo! All
Please
of you.
take a seat.
Take a seat. Yes, that's better, because otherwise it'll be just too long. And Chris, do you have time to take pictures with all of your fans later? Good. Promise. So now you can have a seat. Okay. No. I'll stand. I just have to move around all the time. Yes, that's my thing.
Make sure that you have a mic as well.
So Andy Heffernan. So what is your news of the day today? Yeah, you can have the microphones and pass them on. I thought that we would have 2 more.
One more.
Yeah.
That's okay, yeah?
Yeah, that's okay.
Sorry, could you repeat?
What's your news of the day?
My news
Your
of the
personal
day.
news of the day.
My personal news from the day is I'm going back to Ireland re-energised and recharged, so I am. And that goes back to the opening plenary here we had way back on Monday. When we had people living with dementia who opened that opening plenary. But I think they reminded all of us, in case we forgot, why we're here in the first place. And that, to me, sent a very, very strong message. And I think it provided the basis for the following 3 or 4 days in terms of how we approach and how the presenters approach as well. We never lost sight of why we're here in the first time. Because if we do, we lose everything.
Yes, thank you so much. Thank you so much. Taru, you are from the Social Affairs and Health Department, right? Yes. So what is priority in your ministry at the moment, besides Alzheimer's disease and dementia? Yeah.
We just, in the spring, got a new government and new program for the government. And just now we are finalizing the implementation plan for the program. And there's a lot of issues concerning the elderly, aging of a society, and reform of a whole system in Finland. So in the beginning of this year, we got a new organization of social healthcare services in Finland, and it's a big challenge to get it started very well, including all the population groups getting equitable access to services. And of course, it's also concerning the people with memory disorders.
Yeah, of course.
And especially, we are trying to put the emphasis on the basic services and prevention.
All right.
So it's also here very relevant.
All the themes we've been discussing these days. And how is the new government doing? We won't tell anybody, just tell us. How do you like them?
Of course, it's different compared to the previous ones. And they are trying to do their best to solve a future program. Yeah.
Wonderful diplomatic answer. Because you are the one that stays, right? In the ministry, yes, exactly. You know all, and the government changes. Sonata, so what's your news of the day? Can be very personal. It doesn't have to be
we European Dementia Carers Working Group has its own first ever showcase today. We had first session, and as far as I heard, it was successful.
Ah, great. That's really good. Yes. Yeah. So Anne, because that's your name, right? Anne Remes. You work at the University of Helsinki as well, research and sustainability. So what are you working on research-wise now?
Wow. Yes, I'm acting as a vice director for research, and actually I continue from Taru because our new government has promised more money for research and innovations. So I'm very happy. Let's see how it's going on, and we are doing a lot of work to promote research in Finland at the moment, and also innovation.
That's great. Yeah. Yes, Chris. So you just told me when you walked here this way, I'm tired. You said, how did you?
That's not news.
But you.
I'm sure we're all tired. It's been a great 3 days.
And intense.
Absolutely.
Also.
Yeah, my news of the day is that I woke up this morning and beat my consecutive record of days lived.
Whoa! Yeah. Even more fans. Yes, perfect. We're moving on to you, Elina. What do you think your news of the day is? Because I think that gives you. Yeah, it's working. Just talk.
Okay.
Yeah.
Great. I think my news of the day. Well, we're all tired, but I do feel quite energized. I have to say, not only because I don't have small children here,
a bit closer to your mouth,
but also I think this conference. I mean, they're always great, but I think that there's something about the consideration for inclusivity that you have given to this entire conference that I think is really, really stellar and you don't often see. So I'd really like to thank you and the organizers for organizing such excellent panels and really for thinking it through kind of from top to bottom in that sense.
Yes, wonderful, great. So I would like to ask you all, but first you, Jean. Maybe you can start off, and then anyone who wants to speak takes the microphone. What, Jean, do you think is a key success from the past few years in the strategy in dementia care?
when I look back at the conference, I think the topics that were chosen were the topics that I think we were able to make the most progress. I think on the whole issue of brain health, I think there's been very interesting progress. When it comes to new treatments, we are very close for the first time to really get new treatments that might get approved before the end of the year by the European Medicines Agency. The inclusion of people with dementia and then this whole intersectionality. We're not just thinking about one group of people with dementia, but really across groups, whether it's the LGBTQ community, people from ethnic minorities. So I think we've done a lot of progress, and I think as a movement, at least I feel very proud of the achievements that we have done collectively.
Yeah. True.
I think this has been the most inclusive conference I've ever been to in 10 years.
Yeah, that's really great. Yep.
And it really is nothing about us without all of us. And we're not groups.
Can you say that again, and maybe slowly so we all remember, because sometimes people can't hear it. Not
Jean's favourite phrase, nothing about us without all of us.
Yes.
We're all in this together.
All in this together. Yeah, great. So what would you say, the other ones? Just take the microphone and say, what would be a success of the last years? Yes, go on.
Yes, I think we have a lot of new information about prevention of memory diseases in broadly, and this is something new. We have done a lot of research related to treatments and diagnostics, but maybe the prevention is something not so new, but important.
And improving. And Taru, in the Ministry of Health, is prevention also a major theme?
Yes, actually, it's of a high priority in Finland. It has been a long time. And especially, it was one of the things I wanted to raise also, prevention. And we have got now more and more information about how effective it is. And also concerning the dementia, but also other chronic diseases. So that I think that's very promising, that we can see there are same risk factors, same issues which we can take and have influence on the whole spectrum of different diseases. So it's perhaps more easy to get through this and get support for preventive measures, so that there are the same nutrition, physical activity, etc. It's just the same. So, and especially I'm very proud of the finger model. From Finland. I know you have heard a lot about that during these days, and that's something which we are now trying to, in Finland, to support the implementation of that in whole country. I suppose our minister already in the opening also mentioned that we are now supporting it by financing also. So that's one of the priorities.
Okay, great. And Elina, what do you think as an analyst? Is going well?
Sure. So the first point that I had was also prevention, which I won't repeat because I think that everybody has said this very well. But I think that there is starting to be a shift also in the kind of public awareness, both about risk factors for dementia and the power of prevention, and getting it out of just these rooms and kind of into the public discourse in a different way. I think that has been a big success. I have one success that I think is kind of mixed, and it's not specifically focused on dementia, but it very much impacts care for dementia, which is that I think that there is very much a growing understanding of the importance of quality of care and of the importance of informal carers. And I think some of that has come from what we learned during the pandemic, to be honest, which is why I think it's a mixed success. It's really a success that's born out of the failures that we saw during the pandemic. But I think that appreciation for the fact that this is so important, and it's so important for people who are living with dementia, and for everybody who loves them, who cares for them. I think that is...
what in care improved specifically?
I'm not saying that I think care improved.
Awareness.
I think that awareness that quality care is fundamental, and an understanding that improves not only your quality of life, but also sometimes outcomes.
I see.
And then also an appreciation for the difficulty of caring. I think these are things that maybe there was not as widespread an awareness
the importance is now underlined.
So there's an opportunity there,
I also see that Sonata wanted to grab the mic and wanted to get involved here in this discussion.
I'm just listening, and I would like to reflect my news of the day and the past few years, and to be what I hear, what are we discussing here about minorities, about underrepresented groups, about awareness, about prevention, about informal care. So what is important to me? And we are talking also from representatives from ministry also talking about that. So it's amazing that we have these kind of topics here.
That it's happening right now. Okay, thank you so much for now. We want to go to you, and we want to ask you the question first, because we want to know what priorities do you have for policy and strategy? What do you think? So maybe Menti can be put on. And the next question, please, from the Menti department. Guys in the back. Hi. It'll probably be on. Okay, but you can have your phone, and I suppose that the question will be on there already. Yes, there we are. And we will give them some time. And of course, we want you to answer that question as well. So what do we need? Do we need increasing funding for research, for causes and cure? Of course, both. Do we have to combat stigma even more? Longer, more? Do we need timely diagnosis to improve and make it even more timely? Do we need to promote brain health, like we said, brain health, prevention, insights in that area? Do we need to prepare countries for the introduction of disease-modifying treatments? So are they ready to start with medicine? And are we on the right way with that? Do we... I can't read it anymore.
So that would be improving care for people with dementia, better supporting carers of people with dementia, and making our societies more dementia-friendly.
More dementia-friendly, yes. Communities and municipalities and everything that goes with making societies more dementia-friendly. And we see the votes rise, but don't be influenced by the votes of the audience. So I'm going to ask you, who says the funding of research of you? Just raise a hand, only a hand. Who of you? Yes? Oh, but you have to pick one, right? Pick one, just one. Is it yours, Anna? Research? Yeah?
Yeah.
Tell us, why?
Why? All these are very important, and we really need research for better diagnostics, better treatments, better care, and everything, because every
needs to be researched.
Treatment care should be based on evidence. Okay. And so that is the research.
Is it, and whose first choice is it as well? Microphone? Yeah, there are many of them. Just okay.
I'm delighted to see I'm perfectly aligned with the audience today in terms of the three there, but it's not a zero-sum game. It's not an either-or. All of them in their own right are very, very important.
But what is your choice? I didn't hear.
My choice is improving care for people with dementia.
Oh, improving care. Oh, okay. Okay.
As opposed to, that's not to say research isn't a significant priority as well. But we spoke about brain health and the advances and progress in terms of brain health the last few years and the risk modification, etc. But that shouldn't be at the cost of supporting and caring for those who have dementia at the moment and also their carers. So I think we just have to have a balance in our approach there in terms of what we're doing for the future, but also in terms of people who have it.
But if we improve care, where do we have to start? What is your first priority?
Priority is access to services, be it in the home or long-term care, depending on the wishes of the individual and the family as well. And that to me is absolutely...
But how do we start that?
It's a significant issue across most European countries, I would imagine, from a workforce perspective, from a scalability perspective, in terms of particularly in Ireland, an ageing population. It's a huge challenge.
Yes.
But unless we start planning now, there's no point in planning in 5, 10, 15 years.
Okay, so that's the first thing that needs to be done is planning.
But that can be done concurrently with the research, with the early diagnosis, with the brain health initiatives, etc., with the dementia family or dementia-friendly environments as well. Each and every one of those plays a part and is a factor in the overall ecosystem of dementia.
Elina, your priority.
On picking one priority, though, you have moved to picking almost all 8, right?
Yeah, no, but he said care, improving care. Yes. They all do that. They say, this is my priority and the rest is too, right?
I must be a politician.
We know. Yeah, go ahead, Elina.
So I'm going to cheat by starting by responding and then picking my priority.
Ah, okay.
Because this is also
we all have a strategy here. Yeah.
I was thinking about something that Jean said in the opening, which was this point about how dementia is being folded into broader topics like mental health and aging and disability. And I was almost wanting to turn that on its head, because I think you are right, but at the same time, so many of these issues, when it comes, we are not solving these things well by picking a broad umbrella. Like the issues when it comes to improving care for people with dementia, many of them have underlying structural issues that have to do with the fact that we're not providing
what's
good
your
care
advice?
for people in general, in long-term care, for example. So there are a lot of things that we need to unpack here, but I think I just want to make the point when it comes to improving care that a lot of things around workforce, around the fact that the workforce is very much underpaid. Across OECD countries, an average carer makes 70% of the average hourly wage
so that's the
of
first
the country. So there are a lot of questions
payment.
around training, around recruitment, around quality of the working life. And I think that those things are really important, dementia specifically, but also more broadly when it comes to long-term care.
All right.
And for my priority...
now comes your priority.
Well, they're all priorities,
yeah,
like I said. But I think I'm actually going to choose improving timely and maybe quality diagnosis.
Okay,
because I think that links to a lot of the others. So this is my way of cheating.
Always find a way,
a good diagnosis is really important in terms of putting you on the pathway to getting good care.
Yeah.
But also when it comes to disease-modifying treatments that we're seeing, we need to have that good diagnosis. And we know that we still don't have enough, and we don't have the data, and people aren't getting the diagnosis they need. So there we go.
And Chris, what would you say is priority number one?
I'm going to be as inclusive as this conference has been. And I'm not picking any. We need them all, but I think the most important one isn't research, it isn't care, it's funding. We can't do any of these without appropriate funding. We're the poor illness, and yet we're the biggest illness.
Yeah.
We need
a poor
balance.
illness, but a big
But we need balance.
Just out of interest, because we had a session also around intersectionality, and one of the key messages was we want a care revolution for dementia.
Yeah.
And it was basically saying, if we want to have person-centered care, we can't have care on a shoestring budget, as I call it.
A shoestring
so
budget, yes.
how do we go about doing that, and how do we make sure that carers, professional carers, are funded in a sufficient way?
By making it a priority. By making it a priority, which is what we want to do. So we've got to shout, we've got to roar, as Pia said, was it? Yeah, someone said.
We got to roar.
Don't whisper, roar.
Sounds nice.
Just a quick question to Elina, because you have economic in the name of your organization. How easy is it to convince these big governments
in an economic
to invest
matter.
in dementia care?
Yeah.
No pressure.
It's not easy.
Damn.
I mean, I wish the answer were easier. I think one of the things that's really interesting is that it's clearly a high policy priority, and yet the funding doesn't necessarily go behind it. And I can't explain that.
How come? Yeah.
I really can't explain that. I think that's a question that's, to be honest, beyond me. But I think just going back to one thing that you were saying about improving care and intersectionality, I think one thing here that's really clear as well is this issue of gender and the fact that caring has been a woman's job traditionally. And this is one of the reasons that we see, for example, the fact that the salaries are so much lower, the wages are so much lower, the working conditions are so much more precarious. And so I think that really speaks to the importance of considering broader kind of intersectional issues as well. But yes, in terms of improving funding for dementia, it's so critical. Same with long-term care, and yet it still remains.
And we still need to find out why there's that.
But also,
that
if we're talking numbers, women are more likely to get dementia than men.
Yeah.
It's so that's
strange
not
thing to begin with. Sonata, what's your priority?
I listen and one tricky thing is in my head. In my personal experience, I had, and a lot of my peer friends, it's the same. A lot of us retire earlier than we could. A lot of us just quit working because we can't cope with care.
Yeah.
And it costs to governments.
Yeah.
We become benefit receivers, not taxpayers. So it's very important message to all governments. that costs.
Yeah, true. Important. And then you, maybe, Taru, for your priority. Yes. Economic factor as well there. Yeah.
I already started to emphasize the role of prevention. So I think in the future we can't manage with a situation if we don't take that a high priority. But taking into account all these priorities which has been now mentioned, we need all of them. So actually, I can't make one priority. And perhaps especially most important, I think, is making society dementia friendly and age friendly. So if it's friendly for patients with dementia and elderly people, it's friendly for everyone. And of course, care is important. We need effective, good care, diagnosis, etc. But we can't take only that. We need the other aspects of the society as well, as was mentioned. For example, how the informal carers can cope, how the environment is supporting people with dementia, how the economic situation,
everything,
traffic, everything. So we actually that's something which in Finland we have found important is to have this multi-sectoral approach, and also having civil society there. So all together working towards a friendly society for dementia people.
Again, yes, that's very clear. We have another guest, but we have that guest on video, and she's from the World Health Organization, Natasha Atsopari-Muscat. Yes?
Correct.
European Regional Office, and she wants to tell us something.
So if you could have the video of Natasha, fantastic.
Dear colleagues and friends, on behalf of Dr. Hans Kluge, Regional Director of the WHO European Region, I am pleased to welcome you to this important policy roundtable dedicated to dementia as a European priority. 10 million people live with dementia in the European region. Their number is expected to almost double by 2050, increasing to over 18 million. What's even more devastating is that people with dementia and their loved ones often lack access to diagnosis, treatment and support. Instead, they face ageism, stigma and social exclusion. These negative factors not only harm people with dementia and those who care for them, they are holding back global progress. WHO is working with partners around the region and the world, counting many of you attending this event. We are implementing the Global Action Plan on the public health response to dementia for 2017-2025. And we have a number of tools and resources to support countries in achieving the 2025 dementia targets. But we are in danger of falling short of those targets if we don't step up our work together and push for change across some key areas. First, ensuring that all countries have dementia policies with plans, with appropriate resources and investment so that they reach the people who need them most. Second, we need to set up strong health and long-term care systems to provide universal access to diagnosis, treatment and care. Third, expanding age-friendly environments to be dementia inclusive will be key to make sure that people can connect with the communities and thrive. Fourth, we need to improve countries' capacity to maintain health information systems to inform policy decisions. Finally, and crucially, we really need to increase investment in dementia prevention. Recent breakthroughs and investments in science are cause for optimism and should be celebrated. These advances reflect sustained investment in primary and clinical research and our commitment to develop a disease-modifying drug for dementia. But today, most people living with dementia cannot benefit from or access treatments available. Digital solutions also offer promising avenues to improve the health and well-being of individuals with dementia and their caregivers. Leveraging these technologies can elevate care by facilitating early detection, personalized treatment plans, medication reminders, safety monitoring, and remote person monitoring. Online peer forums can support caregivers. Dear colleagues, we have a collective responsibility to build a society that is inclusive for all, including people living with dementia and their families. As we redouble our efforts to realize the goals set forth in the Global Action Plan on Dementia by 2025, let us draw inspiration from the Finnish concept of sisu, or tenacity. With unwavering determination, we can propel significant advancements in the battle against dementia. Thank you.
And thank you, the World Health Organization. Let me just test. If you have to choose between your optimistic, pessimistic, or just neutral in your expectations about how care for dementia, inclusivity, every priority that we discussed, how it will develop, raise your hand if I say what you are. So if you say, I'm optimistic, raise your hand, please. You can be honest, can be frank, okay. And who's slightly pessimistic? Raise your hand, please. Yeah, care is all right. Yeah, and maybe neutral? You don't know yet. It might go anyway. And with you, so optimistic, hands, please. Oh, there you differ. There you differ. I want to go in the room to ask.
But I'm also
people.
pessimistic.
Yes,
I'm also neutral.
You just don't want to make choices, do you? Maybe if you can ask them about their response. Who of you read the manifest? Be honest now.
I did.
Maybe you can give Jean some recommendations while I go into the audience to ask the pessimist people a little bit.
Could I just say, Jean, it's about time we had another manifesto. Was it 2014, the last time we did something?
We had the Glasgow Declaration, we had the Paris Declaration, and this is really rewriting a bit our political program.
And this is the best one so far.
Good.
Good. But while it's on my mind, I'm going to talk about something else for 1 second. Being dementia friendly does not pay for carers.
Sure.
It does not pay for funding.
Correct.
It does not pay for anything. Let's just, it's nice being friendly, but let's spend the money more appropriately.
Also, sometimes we have lots of very nice strategies or recommendations or policy documents with absolutely no budget attached. So words are very patient and very nice.
Absolutely.
But you need action and budget.
Yeah. And I think the best thing we're doing at the moment in the manifesto is mentioning about disability and about rights. That is a big stick for us. That's something we can use. Andy?
Yeah, I agree with you.
Sorry.
I agree, very much so. It doesn't replace care and funded care at that as well. But even in terms of funded care, and I often say at home in Ireland when we open a new day centre or whatever, someone was there six hours a day. There's still another 18 hours in that person's day. So that's where the dementia-friendly community come in. That's where the sports club, that's where the supermarket, the post office, the family, etc., the GP. And it's important that everyone is aligned in terms of supporting that individual. So it's not an either-or again. I think it's an all of society, all of community response to supporting that person with dementia.
Yes.
But
one moment, I had a pessimistic...
Is that dementia friendly, or is that understanding and education?
But we have a pessimist here. Tell us.
Yeah, the reason I'm pessimistic is I agree with everything that's been said about Alzheimer Europe Conference. It is the best in the world, and I've attended a lot. It's warmth. And we hear such fantastic research. I chaired the Informal Carers Research Group this afternoon. The research is there, the initiatives are there, but we never see it on the ground. It doesn't feed back to us. We've been coming to these since the Glasgow Declaration 2014. Everything is there, but nothing has changed. We've got to get the policies off, or the research off the shelves and into the real lives of people. And I don't know how you do that without money, and nobody's got money these days. In the aspect of care, once we run out of money to pay for our care home, then we get put to a different care home. There's that that economic barrier to people. People that have money will whittle it away, and then it's just, I'm an eternal optimist, but this is one aspect I cannot see changing.
Yeah, you're not encouraged anymore. So yes, please, respond, Elina. Thank you. Thank you so much.
I think that's a really important point that you've raised.
Yeah.
And it's kind of also what Jean had said, that we have these high-level policies and then we have the on-the-ground reality, and they can be so far apart. And we can come every year and we can have consensus on so many things, and then we go home and there's not that much change. And I think one of the reasons maybe I am on the optimistic side here is I do think that there is something that is going to focus policymakers in a way that it hasn't, and that is the advent of treatments that will be accepted by the EMA. Okay. And policymakers respond to money oftentimes in terms of if a treatment is going to cost a lot of money, or if you have to suddenly think about how you're going to incorporate a treatment that people are going to want, then you often act. And I think oftentimes, obviously, that will be related to the treatment itself, but then oftentimes it relates to the kind of broader ecosystem around that treatment.
Thank you. Anna?
And so I'm optimistic in that sense.
Just a very quick follow-up question. Aren't you thinking that governments might be so afraid of the numbers that we're talking about, that might even lead them to inaction and saying, well, this is such a huge cost that we will not be able to address that?
No, I don't.
Go ahead. Go ahead. But the question was for her or for Anna?
It was for Elina. Yeah.
Okay, I said Anna. Yeah. Okay.
I don't think so. I mean, we've seen this with other drugs, for example, with hepatitis C, and it is super overwhelming, but you also have to react. You know, there is so much pressure. When you've been having this narrative for so many decades that there's not that much you can do, which I know is not the correct narrative, but this is the public perception, and there is something that will actually shift that. Policymakers don't have the space to say we're not going to do this because it's too expensive.
Anna, you wanted to say?
Yes, I am optimistic because I'm also a neurologist, and I have been working with patients with memory diseases and dementia during 20 years, and there's huge improvement in diagnostics, care, attitudes, everything, but very slowly improvements. And I really...
Huge but slow.
Huge but slow, during 20 years.
All right. So I would like, now we want to switch to the recommendations that you have to the manifest that has been written. So you've all read it, so maybe anyone of the others wants to comment on that and make a recommendation on the manifest? Yes, go ahead.
Well,
and if you do, raise your hand.
Looking at the manifesto, it's very aligned in terms of the direction of policy and effort and focus in Ireland. And we mentioned politicians earlier, we mentioned governments. We can be somewhat cynical, myself included. But I find, particularly over the last few years, there's great collaboration and alignment of the desired outcome across government, politicians, across our National Dementia Office, of which I see some colleagues here today as well, our Health Service Executive, and organisations like ourselves. And that's a very, very powerful alliance. When those people come together, they can make things happen as well. Because sometimes we forget, by and large, people are looking for the same outcome. It's just how we arrive there.
All right. Any other recommendations for the manifesto? And if you have one, you say we need to change something there, or something has to be underlined. No? We're not there? Okay, yes, go ahead.
About the manifesto, I think it's very good that it's raised up the research. And it was already mentioned by someone here, but data is very important there if you want to make the politicians understand what's the situation. Data about the forecast about where we are going, and especially if it's possible to have information about effectiveness and also money. So that's something which sometimes makes it important or necessary to make some decisions about the future. So I think it's very good to have a visibility and understanding increased about this issue. And so because of that, I think it's great that this kind of conferences are there. And for example, I think it's for Finland now a very good place because you are here and you create this visibility and support our activities. So I hope this same happens in other countries. So, but knowledge and understanding about the situation, it doesn't happen by itself. So that's something which we need a lot of common understanding. And what was said, just it's not only social and healthcare issue. We need the others as well to work together to have something in the future to happen.
Everybody needs to work together. Thank you so much. So let's move on. And I want to know, and now I'm asking you not for a theme or a priority, but a moment in the conference, if you were there, that you thought was a highlight, a moment, something you really liked. Think about it just for a second. That's all fine. And then maybe tell me, but a few of you just came in this afternoon to be here, so that's hard. But yeah, you want to say something, yeah?
I think that's great to have so many people around this issue. So that's something which I think we are stronger together.
Just the amount of people
yes,
by itself.
The amount of people which have a priority on this.
Yeah, and Anna?
I met a lot old, good friends.
Great.
And new friends as well, I hope.
You met, yeah, reunited with many people. That's good. And you, Elina? Oh, Chris first. Go ahead. Yeah.
Yeah. Okay. The best point for me, always for me, is seeing people trying to live as well as they can with dementia and coming here for the first time and speaking out.
Speaking out, yes.
And it changes people's lives.
It does. Do you remember
We've heard
a person?
Pia and Vera, who were absolutely excellent. They haven't spoke to a crowd this size ever before, and they did it.
Great.
And they enjoyed it. And also, Ruby and Pasha. I don't know if you saw Ruby and Pasha talk from Canada. Absolutely, what a strong lady and strong husband.
All right.
Fantastic.
Elina, there you go.
Elina?
Elina?
Yes. So I have two moments maybe. One is more on the research that was being presented. I only got in yesterday, but I was at a session today that was on data sharing and linkages on this topic of data. And I was really blown away by the advances in this area in the last couple of years and how exciting it is and how much effort there is going into being able to link data and share data across different research projects. I think that's hugely encouraging. And the other thing was, as I was checking into the hotel yesterday, two people just walked by and they were looking at their programs and they were like, I just don't know what to do. There are just too many interesting sessions to go to. And I think that was just really great.
We've heard that a lot. Yes, go ahead.
As I said earlier on, the opening plenary, it was very, very powerful for me.
Yeah.
The session we had yesterday, the parallel session on LGBTQ+, I think really, I thought I knew stuff, but it opened my mind even more. But also what I love to see, and I see it in Ireland as well, is the amount of young people who have taken an interest in the whole area of dementia and are looking to devote their professional life to dementia. And I think that's wonderful for the future.
Yes.
Just one added, a lot of young researchers, but a lot of young women researchers as well. So really the future of dementia research in caring seems to be female because the numbers of women in this conference has been amazing as well.
Yeah, but we want 50-50, right, or not?
I don't know.
Oh, okay, good. Sonata?
No, I think that I totally align with what Andy said just.
The opening.
Totally.
All right, thank you so much. So we have video coming up now, and it is about the highlights of this conference. We've been watching that little movie about last year, but now I think we're ready for our clip of this year. Curious. Yes, beautiful. To the ones who made that film so rapidly. Great work. Yes. Thank you. What a ride it's been. We have to thank them. We have to thank
That's
our
absolutely
experts
something we should have
for
done,
addressing all the issues that we wanted to come up. And you cannot let them just leave by now. One more sentence. All right. Okay.
I think one person that needs thanks, apart from John and everyone else, is Petri. Petri has done. Petri, I don't know if you know, but Petri has done 8
different presentations.
Wow.
He's also been interviewed by the news.
He's been on the telly.
And he's so proud of Finland.
All right, Petri. Bravo. And with that, we say thank you. Thank you for traveling here. Thank you for talking to us. Thank you so much. Yes, we couldn't leave you without saying thank you, of course.